Hello and welcome to topic one, ADEI and diagnosing major mental illness. This week it's important because we are beginning with a topic that sits at the intersection of clinical judgment, ethics, power, culture, and social work values. When we talk about psychopathology, we're not simply learning how to identify symptoms or apply diagnostic criteria. We're also asking who gets labeled, who gets believed, who gets access to care, who is misunderstood by systems that may not fully recognize their lived experience. So, diagnosis can be extremely helpful, but it can be tricky. It can open doors to treatment, services, insurance coverage, medication, accommodations, and understanding. But diagnosis can be harmful when it is rushed, when it's biased, when it's culturally disconnected, or used to reduce a person to a label. This week we are focusing on three major areas. First, we will discuss ADEI principles. That stands for anti-racism, diversity, equity, and inclusion. Then we will connect these principles to ethical dilemmas in social work practice. Then we will begin thinking about the process of diagnosing major mental illness in a way that is accurate, that is respectful, that it is culturally responsive and professionally responsible. Okay. So let's begin with discussing what these things look like and how we can learn from a place of understanding and a place of openness. All right, let's first define what these things are, right? We need to learn what anti-racism and diversity and equity looks like from our understanding of social work. So in clinical practice, we sometimes talk about diagnosis in a simple technical way, and we gather symptoms, we compare these different things, but ADEI asks us to notice power, context, access, and bias. Ethics, in the other hand, asks us to protect dignity while making difficult decisions. And diagnosis asks us to organize symptoms without reducing the client to a label. Looking at this different standpoints, we want to make sure that we understand what these things look like. Anti-racism means actively identifying and challenging racism at individual, institutional, and policy levels. In social work, this means that we do not only ask, I treat everyone the same way. Treating everyone the same can actually ignore unequal conditions. Okay, so anti-racism asks us to examine how systems create different outcomes for different communities. Diversity means recognizing varied identities, lived experiences, histories, strengths, and needs. And it's not only about race, it includes ethnicity, language, gender, um, sexuality, disability, religion, family structure, and much, much more. Equity means adjusting access, resources, and supports so that outcomes are not predetermined by oppression. Equity is not the same as equality, all right? Equality gives everyone the same thing. Equity asks what each person or community needs to have a fair opportunity. Inclusion means creating conditions where clients and communities have a voice, they have belonging and influence. Inclusion is not just inviting someone into the room, it means their perspective matters. Okay. So let's work on challenging the concept a little bit. if ADI states a little bit of abstract or difficult for you to understand, it does not change practice at all. You can define all these things beautifully when you write a treatment plan, right? You can look someone in the eye and really just be present with them. So we want to make sure that we ask more of ourselves, not just the definition, but something like, how does this define my practice? And does this definition change what I do with a client? All right, let's move into what you'll be doing in your different discussions. So discussion 1 is how to build a strong definition of these different things. And the prompt asks to build an ethical dilemma where social workers face while promoting equity and inclusion. So you're asked to reflect on ethical dilemmas that we might face when striving to promote equity and inclusion practice. So think about the different ways where you can talk about maybe where is power operating? Who has access? Who is excluded? Whose perspectives are treated as credible? What barriers exist? I would suggest you use the Code of Ethics to help you with this discussion. There's a lot of information that you can find in talking about competence and dignity and worth of the person, social justice, and different things. So our other discussion goes more into understanding major mental health illness. You'll be kind of diving a little bit deeper on that DSM, the Diagnostic Statistical Manual, building a foundation for how to think critically and how to use it, and talking about the different things that you'll be learning while addressing diagnostic criteria. All right, these are some of the diagnostic tools that I suggest you look into. I've placed them in benefits and limitations. You can kind of look at the critical components and the common diagnostic language when you look at these things. And our manual helps us, with communication, documentation, treatment planning, and continuity of care. And adding these diagnostic tools help to bring a more of a full diagnostic idea of what we're looking at. It can suggest also severity, and it can answer many different questions that we may have regarding different illnesses. Our paper for this week, our personal reflection paper, requires you to think critically about your professional experience. It's not a casual journal entry. This is a professional reflection. This means it should include your own thinking, but it also needs structure. You need evidence and accountability. You're asked to reflect on recent field placement experiences that you've had. Hopefully you've come to this class already with a little bit of field experience. You may use 2 to 4 examples or scenarios, and these examples don't need to include identifying information, so please leave those out. Client identifying information. Keep confidentiality in mind when you write these. You also need to describe the process of evaluating symptomatology and diagnosing clients with major mental health illness. This means you should include and explain how a social worker gathers information. So consider DSM criteria, assessing severity and impairment, look at rules, things that your alternative explanations, consider cultural context, and documents carefully. So you must explain 2 challenges you anticipate when diagnosing major mental health illness. Explain what this includes. Maybe you have limited information. Maybe you have overlapping symptoms or comorbidities, stigma, client mistrust, all the pressures and all the things that create a little bit of complexity into diagnosing. You also need to explain how you will ensure your diagnosis and accuracy to respect your client's experiences. This is where you can discuss maybe client voice, informed consent, consultation, supervision. And then don't forget to include the Christian worldview component. And this should be handled thoughtfully, right? So a social worker with a Christian worldview should approach diagnosis with dignity, compassion, humility, justice, and be careful not to frame the client's symptoms as a moral failing or spiritual weakness, right? So we want to be careful not to impose religious beliefs on the client. The ethical approach is more to honor dignity, support healing, and respect the client's own beliefs and values. So that is what you'll be doing this week. I've added some references and some sources for you to gather for this. You know, some of these explain like tools, systems, assessments, and things like that. So I want you to maybe look at how these can support your writing. Okay, so if you have any questions, you know how to reach me, and please find this particular PowerPoint also attached to the lecture. I'll see you around. Bye-bye.